Welcome, everyone. Thank you for joining this webinar today to go over the framework. My name is Alder Lyon. I'm a vascular surgeon, but also the director of Biodesign for Digital Health and one of the co-founders of CardinalKit. And what we want to, I'm just going to start off the, we have a lot to cover today, busy agenda. I'm just going to quickly go over, why CardinalKit, why is this a great time for digital health? And then Vishnu is going to take over and he'll introduce himself and go over some of the features in detail, go over the sample app, kind of show off the dashboard we've been working on. And then we'll have some really cool demos from two teams that have been using CardinalKit. And then we'll have some time for Q&A. So, this is something I always love to talk about as to why, why now? And it really, one way to think of it is that this stage is really set for digital health. And there are three, I think if you had to think of a Venn diagram to put together all the pieces that are making it possible, I think the data piece is a big one. And it all started with a high-tech act where, tens of billions of dollars were poured into the US healthcare system to digitize the electronic health record. So we have now, over 90% of clinics and health centers have electronic health records. We have the trend of just increased connectivity through mobile devices and so on. So that's a really key feature that we live in this very data-rich world. There have been a lot of changes with regards to reimbursement for patients who generate data, whether it's through the remote patient monitoring or RPM codes that exist. There's an increased adoption of value-based care. I believe this year, a little over 50% of all the patients are under some sort of value-based contract where the kind of equation is, or the model is completely flipped. The health system that's at risk is valued for keeping someone healthy, being preventative. And that's kind of the sweet spot for digital health. And then lastly, we have the regulatory changes, whether it's from the FDA for the, where they've kind of helped define and provide guidelines for software as a medical device. But also more importantly, the 21st Century Cures Act final rule, and I want to dive into that a little bit. So in March of 2020, I just have to highlight this because it's such an enabler for what we're all excited about. The final rule made it very clear that information blocking is a big no-no, and they've set penalties and so on in place for any sort of information blocking. And more importantly for us in this group, they've made it a legal requirement for every electronic health record to have an outwardly facing API using the FHIR standard to send and receive eventually all data elements that are in the EHR, which is pretty crazy. So this is where the huge opportunity lies. It's not fully available quite yet. I mean, pieces are. But if you look at the timeline of where we are based on when the rule was published and where we are here in 2021. So, things have been delayed a little bit because of COVID, but starting, next year and especially the year after, these electronic, health information, exposed ABI component is just going to unleash incredible amounts of data. And really a good way to think of it, or this is how I like to think of it, is that really the consumer, the patient is now really the key to accessing the data. So we're moving into a consumer/patient authorized data exchange. So instead of, worrying about how am I going to get the data from the EHR or from the hospital, as long as you're very transparent with the patient and they give you approval to use the data to help them in whatever way they need, you're going to have access to this data. So I think this provides an incredible opportunity for all of us here. So, the journey to build a healthcare or any sort of health app is incredibly complicated. You have an idea, You need to then, write down that idea and then think about, how is it going to be built? You have to raise money, you have to hire engineers. And then you have to, if you're doing a research study, worry about the IRB approval. Am I handling the data correctly? You need to test it, fix the bugs, validate, and then finally get to do your research. So it's a very complicated process and road. And there are many, many, many stakeholders involved, whether it's the developer, researcher, the university, our institutional review board, the end user, the privacy officer. So there's a lot that needs to be managed. And this is often too much of a very tall barrier that is just too much for many people. And so many projects end up kind of dying on the vine or take forever to implement. And so, it's a tall order to get one of these done. This is a slide borrowed from Mike Kittle. I don't know if he's on or not. He's one of the co-founders of CardinalKit, but I love this analogy where, it's almost like climbing, Zermatt. This might be Zermatt. It's a really tall order and it's very expensive. In the order of over $150,000, $200,000 to do a formal beginning to end research study. And because of all the challenges, many projects don't even make it to launch. A lot of them die before the launch, and it can take up to 2 years. So, we felt this pain, and as developers and researchers, we got asked all the time, like, how did you do it? Can you help us? And so there's a great need to kind of build this cable car, like get people maybe not to the top of the mountain, but let's get them 80% of the way there, 60% of the way there, depending on what you want to do. And really that's at a very high level. That's what CardinalKit is doing, is trying to, from the get-go, provide a platform, a framework that takes into consideration all the stakeholders and tries to manage them as best as possible, and lets you then fork, from that starting point, the project to kind of customize it to the way you need it, you want it, and hopefully get you there quicker and at a lower cost. So that's what CardinalKit aims to be, an open source platform, code base for digital health research and applications. So I think, Vishnu, which slide do you take over? I guess I gotta, do you take over?
I think I take over at this one. Yeah, that slide.
Okay. So yeah, I kind of went over this, but just, I think it's important to highlight, we did this in partnership with a university, so that we here locally for us, the way it's designed, it's kind of pre-approved every project, so that, once you build it, you can just point it over to the university back end, and then they can, they'll take over the controls, the access controls, which for this environment is important to do research studies with Stanford patients. But, in every scenario, it's different, and every location, it's different. So it's important to bring in as a partner early on, if you're working with an institution, to bring in the institutional partner. Just wanted to mention that. So go ahead, Vishnu.
Thank you, Oliver. That's a great introduction to the vision behind CardinalKit. And I want to go into a little bit more of the technical aspect of it. Just to introduce myself, I am an internal medicine physician. I practice primary care, and I'm also a software engineer. I've built a number of digital health apps over the years. And I'm also currently involved in developing international mobile health data standards. So I'm glad to be on the CardinalKit team and showing you some of the work we've done. And I think one of the most beautiful things about CardinalKit is that it is an open source platform that you can download from GitHub and use to build a complete end-to-end app, including a front end and a back end. And that's what you see on the slide here. So CardinalKit marries all the front-end components with the back-end components, so you don't have to build and integrate and wire all those things up together. And we use all of the industry standard technologies. So for example, our front end is an iOS app at the moment. It uses ResearchKit, HealthKit, CoreMotion, and a number of other SDKs that are provided by Apple for health developers. And we've wired all that together, so you don't have to figure out the details of how to do that. And we provide you a mobile app template that you can actually get up and running with within an hour. And I'll show you that in a little bit. And also we have a backend that is built on Google Cloud, and it's fully managed. So you don't have to set up your own servers. You don't have to manage the scaling or any of that sort of stuff, because we use Google Cloud's Firebase suite of tools, which includes database, includes authentication, includes cloud storage. And these services are also HIPAA capable and are encrypted. So if we can go to the next slide. Yep, perfect. So we have three main components to the CardinalKit open source platform. The first is the example application, which as I said, is a full-fledged application that you can boot up and run, and it'll work out of the box, and then you can customize it for whatever unique purpose you need for your app or your study. Then we have the CardinalKit library, which is our data collection and processing engine. And what it does is it takes data from all sorts of different devices that the patient might have, anything that interfaces with HealthKit, and it converts it into internationally standardized formats like OpenMHealth and FHIR. So OpenMHealth is actually a standard for mobile health data that I have worked on, and now it is an IEEE approved international standard, the first of its kind for mobile health data, and we are the first framework to actually support that. And FHIR is a format for data exchange between healthcare information systems like EHRs, for example, and it is actually mandated by federal regulation now. So being able to get your data into that format is really useful if you want to interface with any of the electronic health record systems or other FHIR supporting systems out there. And then the third part is our dashboard, which is a web dashboard that clinicians or researchers can use to visualize the data that patients are collecting, look at survey responses, and also manage the surveys basically from the cloud. Can we go to the next one? Perfect. And this is a kind of overview of our data pipeline. So we have patients, they could be using wearables or other connected devices. That data is collected by the app that you build with CardinalKit. Some of the really cool features are that we use data encryption at rest and also in transit. So everything is fully encrypted. We use two-factor authentication. The app locks whenever it goes into the background. So anytime you open up the app, you do have to put in a passcode. So all the data is secure and encrypted until the passcode comes in. And patients can have full capability to choose which pieces of data they want to share and when. So we do allow very granular data sharing permissions. And on the backend side, like I said, we have a fully serverless backend, so you don't have to manage any servers on your own, using Google Cloud Platform that is auto scaling. And the box all the way on the right shows that we can plug into the Stanford Medicine's existing Google Cloud instance and allow them to take over control so that you can deploy your app easily at Stanford. But this can also be extended to other institutions and commercial projects, anything that can run on Google Cloud. So this is an example of a more sophisticated architecture that you can build with CardinalKit, and we are currently in the process of developing the pieces for this. But the idea is that, if you want to build an application for clinicians, one of the core things that you'd want to do is make that application integrated into clinical workflow, which means you're going to need to build it to interface with the electronic health record system. So that's what we're showing here. Because all the data that we collect from patients is converted into FHIR, we can then take that FHIR data and use services like Google Cloud Healthcare API to store that in a FHIR compatible store with a FHIR API. And then we can make that data available to a smart on FHIR dashboard, which is basically a dashboard that will open up inside the electronic health record when a physician is inside a patient's chart. It'll automatically detect which patient they're working with, pull the appropriate data, and log them in all in one step. And I'll show you an example of an experimental dashboard that we've built for that. The third piece is that all the data that we collect can be imported into BigQuery, which is a product from Google that makes it easy to do lots of different standard analytics and machine learning. And finally, the final piece of the equation is HIPAA, of course. So the thing we like to mention about CardinalKit is that it is HIPAA ready, but it's not HIPAA compliant because there is more to HIPAA compliance than just the technical side of things. So as you can see, these are the seven elements of HIPAA compliance. So there are policies and procedures and designation of a compliance officer, et cetera, et cetera. So we help you provide the technical standards for HIPAA compliance, but it's important to note that our product is not HIPAA compliant until you've checked all the boxes off yourself. So there is more to do. And that's what this shared responsibility matrix is about. It's about the framework providing you the building blocks to become HIPAA compliant, and then the team actually providing the rest of the functions. And together between CardinalKit and the team developing the app, we can make a HIPAA compliant solution. And I think that's also what this is, right? Okay. And I think the last point here is that CardinalKit is partnered with University Research IT, which is really cool because I think on the next slide, there's a, yeah, TSA PreCheck is what we call it, because the idea is that because we're partnered with University Research IT, it's easier for you to get your mHealth products on the IT platform, because that is essentially to some extent pre-approved. And Oliver, I think you had already mentioned these.
Exactly. Yeah. That the idea is that, we're helping manage the risk that, everybody's worried about privacy, security. And so the framework is just designed to help manage that for you. It doesn't do it in its entirety, and that's why it's a shared responsibility. We love that phrase or that term. So yeah, basically to recap, we're trying to get you 60% of the way there, 80% of the way there, depending on your project, and save you time and money, and really just to unlock the tremendous potential that there is with digital health, because we have so much to learn. I mean, all the data, this continuous monitoring that we can do now that we've never been able to do. There are insights that can be gained, but we can only kind of make them meaningful or figure out what they mean and how to use them if we study them and compare them to clinical metrics and so on that we currently use. So we need help to get out of the dark ages of medicine, or the way it's always been practiced. So
Totally.
That's the excitement.
And the most exciting thing is that list there, which shows you all of the, that list there, which basically shows you everything that you get to start out with. And, as a person who's built a lot of digital health apps in the past, a lot of the time you're essentially starting from scratch and setting all this up. So the beautiful thing about CardinalKit is you get way ahead of where you would have been if you had to start from scratch.
Perfect. All right.
Cool.
So I'm going to stop sharing now. That's the end there. We're going to save the questions for the very end. I mean, if anyone has any. But let's, so Vishnu, you're going to go over a few things, right? You're going to kind of open up Xcode and kind of show how it works.
Absolutely. I'm gonna start by just showing the app, the sample app that you can get from our website and from our GitHub, and then I'll dive into some of the features, and then we can go and look at how you would set it up in Xcode. So if I can just start sharing. Hopefully everybody can see my desktop.
Yep, we see it.
Perfect. So this is actually my phone. And I just want to open up the CardinalKit example app. So like I said, this is the application that you can download from our site today. And of course, when it opens up, it asks for a passcode. So everything is encrypted. And when we're inside, you can see that on the main screen here, we can assign tasks for our patients or our users to do. So we have a couple of example ones here. So we can create surveys. This is a questionnaire. And you can have different types of inputs. So this is like a slider. You can have a multiple choice element. You can have a form with multiple questions at the same time. And that data will then get saved to the database. You can also have surveys that are visualize the data directly inside the app. So that's what this coffee survey will allow you to do. So for example, I'm going to bring up the visualization first. So as you can see, I haven't put any data into the coffee survey. So now I'm going to say I'm drinking 5 cups of coffee, which is a lot, but that's what I'm going to track. So then if I go back to my results, now it'll say that I've entered in 5 cups of coffee. So you can visualize the data as soon as you enter it, and that data is also going to the back end. In addition, you can schedule tasks for your users to complete. So as you can see on this screen at the top, we have dates, and each date has a circle. So if you're familiar with the Apple Watch's rings, essentially you can schedule a number of tasks for that day, and as each task completes, a percentage of that ring is going to close. So right now, one of the tasks that I have to complete today is 2,000 steps. I have only done 65, but if I'd done 2,000, then I would get a quarter because I have 4 tasks here. And then, you can go back and see other days. So pretty cool way to kind of schedule surveys or other things that you want people to do in your app. We have a contacts tab that you can populate with, potentially providers, if this is a clinical app, or research administrators, or anyone you want the patients or users to easily be able to access. And then on our profile tab, it allows our patient to upload their latest health records, change their passcode, view the consent document. I'll show you how that works in a second, the consent process, and withdraw from the study. So now I just want to walk you through the onboarding, which is another feature that we provide you out of the box. So I'm going to open up the app again. So this is I think this is kind of obstructing your view. So this is how the app would open up for the first time. And I'm going to go ahead and join the study as a new user. So we have a number of screens where you can kind of explain what your app is, what it does, what kind of data you collect, why you're collecting that data, what you're doing to protect the patient's privacy, what you're going to be doing with the data, if there's a time commitment. And the cool thing is you can actually completely modify all of these screens without changing any code. And I'll show you how to do that as soon as we finish here. So I think all of these can be changed. And then you can provide, if you'd like, a consent form for the patients to sign. So this is really useful if it's a research study, for example. So I can choose to agree to the consent form, put my name in, and sign it. And it'll generate a PDF with my actual signature. And now we use sign in with Apple. It's fully integrated. You can also use email and password sign in. You can also use dynamic links. So those are all possible. We prefer sign in with Apple because it's really easy. You just need to tap here. Here I do Face ID. Then I'm signed in. It asks me to, well, I've created a user account. Now it asks me to put in a passcode. So I'm just going to do 1234. Confirm that passcode. So now I have a passcode. Then it's going to ask me for permission to read my activity data, my health records. I'm going to okay those. And then
the first time you go through those, it's pretty granular. It asks you specifically, which data element.
Right.
Especially with the health record. Yeah, it's okay. No, it's okay. You don't have to go. But it's just,
let me go through it again.
I think that's really important. And it's kind of crazy that, you can get all this, the health record info.
I think the issue is that I've already done it on this phone, so it's not allowing me to do it again. Because it's already.
Oh, okay, that's fine. No biggie.
Completely, sorry. I'm going to try one more time, but I might actually have to.
No, don't worry about it. It's okay.
You can delete the app to get that screen to come up again.
I just wanted to explain it. No big deal.
Got it. Yeah. So basically, it will allow you to choose specifically which pieces of data you want to share. Sorry about that. But anyway, that's the mobile app. And I also want to show you the dashboard. So this is our web dashboard. And this is the view that you would get if you were like the administrator of the application, or you could be a doctor, or you could be a researcher, and you can have multiple studies that you're running at the same time, or multiple clinical apps. So I'll show you an example of a demo one that we're running. So here we have a bunch of sample patients, and then we can go into our sample patient and we can visualize all the data. Just give it a second while it loads the data. Here we go. Okay, so this is all the data that was collected from the mobile device. So if you go into activity, you can see, I've got step count, flights climbed, energy burned. And if you want to drill more into that data, you can actually get a graph. So here's a graph. You can change kind of the start and end dates. if you want to look at different dates, you can actually get all of the raw data down here. And you can do that for any of these data categories. So we have heart rate, we've got, and this is just what this person was collecting, but any health kit data type we can handle. So this is calorie count, respiratory rate also, and then we can get data from answering surveys. So this is the survey tab. I don't know if this person's done any surveys, probably not, but if they had, then their answers to those surveys would be here. And the other really cool thing we can do from our dashboard is we can actually create new surveys and schedule tasks. So this is an example of our survey generator, and we can go to create new survey. And I don't want to take a lot of time going through all of this, but essentially you can put in information about your survey, like the title. You can add questions, and then we have a number of different types of questions. I showed you a couple of them, but you can pick what type of answer you want. And so like if I take multiple choice, I can put in my question here, and then I can put in my options. I can add more options if I want. And then when I save it, that survey will actually get pushed out to everybody's phone that has this app installed. So that's really cool. They don't have to download anything. They don't have to update anything. It'll automatically get pushed out, and then we'll start collecting data. And we can actually visualize the data here. So these are some of the surveys that we've been testing out. So I made a survey to ask people if they like candy corn. Do you like candy corn? I had 3 options: no, yes, and sometimes. And so I answered no. But basically the idea is whatever survey you have, you can actually visualize all the data as it comes in, and you can download all the data as a CSV file. So if I hit download here, it gives me a CSV file that I can use, import into Excel or any other type of spreadsheet. I don't know why it keeps opening numbers.
And you can also use, you can, if you wanted to work from within the, what is it, Firebase, Firestore, you could do that as well, but this is easier.
Mm-hmm. I'll show you that in a second as well. But this is really easy because, this can be imported into any sort of application. It's just a standard CSV file, and it gives you each user ID, the answer, the date and time, the question and the identifier of the survey, the options, what they chose, what kind of question it is, and that will be there for every question in your survey and every user that answers it. And as Oliver mentioned, you can also find that data in Firebase. So I'll show you Firebase, what Firebase looks like. So Firebase is just a cloud hosting environment, and it has a built-in database called a Cloud Firestore. So this is our database. When you hook up your application to Firebase, it'll automatically populate the data into this database. You don't have to do anything special, but essentially you'll have a set of studies. So here we have a few different studies. This is our example study that we were looking at. And in the example study, we have surveys that we created. These are all the surveys. And you'll see that they have, different questions and whatnot. And that's what we created through the survey generator. But if you go to the user collection, each user has data if they've uploaded data. So here's an example of a user that has uploaded data. So the cool thing about this is we have data available in multiple formats. So this is data available as a fire observation. So each piece of data is a fire compliant observation. And you can see that this is a hand washing event. This is, hand washing, stand time, sleep data, physical activity, all sorts of data that we collect off the phone. And we can get that in Fire, and we can also get it in the OpenMHealth format. And this is just an example of some of those data points in the OpenMHealth format. So all the data is in the database, and you can use it from the database. You can export it to BigQuery, which is a SQL database, and then you can do, analytics from there. And we also have a couple of metrics. One of the metrics we have is activity index, which is a measure of a person's activity, basically, a moving average of their step count. And so we calculate that automatically, and that's in metrics. You can add your own. We also have all of the answers for each person's surveys. So this person took all these surveys, and as you can see, here are their answers. It has all the options, and it has what they answered. So in addition to getting it from the CSV file, you can actually use all that data directly in the database. That's basically what Cloud Firestore is. And then if you go to the authentication tab, you can see this is where we manage all of our users. So we'll see all of the users that are enrolled in our study, how they're authenticated with Apple or Google or email, and when's the last time they signed in, when was their account created, all sorts of stuff. So that is the Firebase portion of the project. And then I wanted to show you one more thing, which is our Smart on Fire dashboard, which I mentioned is the dashboard that we can integrate directly into an electronic health record system like Epic or Cerner. And I just want to show you a really quick 1-minute video of it in action in a real electronic health record system.
With CardinalKit and Smart on Fire, we can build dashboards that allow clinicians to work with patient-generated mobile health data from within an electronic health record system. Here's an example that we've created for managing hypertension. From the chart of our fake patient, we can click a button to open up the dashboard. We're logged in automatically and the dashboard recognizes the current patient. Here, we can view blood pressure data and medication logs collected by the patient at home, in addition to relevant information, including the patient's current medications and related laboratory results from the electronic health record. We can also investigate the data integrity to gauge the completeness of our data and track our patients' engagement. Being able to combine data from mobile devices and the electronic health record within a clinician's workflow is quite powerful. We're excited for the possibilities with CardinalKit and Smart on Fire.
And I think that, if you're a clinician, you can definitely grasp the benefit of being able to launch that within your workflow.
Oh yeah, and marrying both data, you're putting together the way you want it and presenting it in a meaningful way for that clinician, for the provider, which is incredible, right? You took the medication data from the EHR, the wearable data, and presenting it in a meaningful way. So
absolutely,
super important.
Absolutely. That's exactly what we were kind of going for, to make it kind of seamless in the workflow. So you don't have to go to a different browser and log in and look up your patient. You can do it as part of your normal environment that you work in. So that's our dashboard. I think the other thing that I wanted to show you is essentially how to get started. So the place to basically get any information about CardinalKit is cardinalkit.org. That's our website. And on our website, you can find our documentation. If you click here on docs, and our documentation will actually walk you through all the steps needed to set up the project. It looks like a lot, but it's actually not. You can do this in under an hour. But all that information is here, including information on how to set up the dashboard and how to create surveys and all that is all available here. And the actual code for our platform is on our GitHub. But before we go there, I just want to point out, if you go to our community tab, we have all of our events listed here. If you go to our resources tab, there's some useful information about designing and developing your own project. And if you want to join our Slack community, we have a pretty active community there, and you can feel free to ask any questions that you have. But now let me jump on to the GitHub. So if you get to our GitHub, you'll see this is where we have all the code for our mobile app. On the main branch, that's our version 1 app. The version 2 app, which is what we're showing today, is on the beta branch. So it's still a beta, but it will be finalized soon. We would love anyone to try it out and give us your feedback, any kind of feature suggestions or anything that you think would be useful. That would be awesome. But essentially, to get started, if you're a developer and you know how to use GitHub, essentially you would clone this repository to your computer. If you're new to GitHub, basically you can either install the GitHub software on your computer and clone, or you can just download the zip file here and it'll package it up and expand it onto your computer, and then you can get started. And once you've done that, you open up the folder, you'll see all the files. And just to quickly show you where everything is, CardinalKit example is the template app that we've created. So that's the app that we were just displaying, and you can use that to build on top of. So if we click open into there, you do need Xcode installed on your computer for this to work. And you also need a package manager called CocoaPods. All that information is in the documentation, but essentially you'll need to go into CocoaPods and install, I'm going to your terminal, run pod install, which will download all of the dependencies that you need for the software to run. It's really simple. And then once everything's installed, you will open up the CardinalKit XC workspace file, which will open up CardinalKit in your Xcode environment. And in order to do this, you do need a Mac, and you do need at least Xcode version 12. And it would be good to have an iOS device to test with. You don't necessarily need one. Oh, shoot. Hopefully that doesn't take a long time. I don't think it will. This is one of the M1 machines, so hopefully that goes quickly. But yeah, so one of the caveats is if you do want to test with Apple sign-in, what we've noticed is that there are some bugs with the Apple simulator with Apple sign-in. That's an Apple issue. So if you want to use Apple sign-in to test, you should use it on an actual device as opposed to the simulator. But as soon as my Xcode opens up, I'll be able to show you how you can actually edit the code. And there are a lot of things you can do in CardinalKit without actually touching the code, which is one of the really cool things about it. So here are all of our files. And if you look in CardinalKit example, again, that's our sample app. There's a file called CK configuration. And CK configuration is essentially a list of values that you can edit. And when you edit those values, those changes will be reflected in the app. So for example, you can change the title, you can change the name, the contact information, all that sort of stuff that you saw on the front screen. But you can also change all the details that I showed you before in the initial onboarding process. So you can change like the, sorry, where is it? Consent form, all the details in the consent form. You can change the withdrawal information. You can create your own consent form. You can also, like, let me just open up the onboarding here. So in onboarding, we have those 4 screens. You can actually put in the information that goes on those 4 screens. And there are other things you can change as well. So for example, you can choose a 4-digit or 6-digit passcode. You can change the text that comes up when someone, as simple as something like when someone puts the wrong login code in. But more interestingly, you can actually select all of the pieces of data that you want to request from the user. So if you go down to HealthKit data to read, you can actually put in the names of all the pieces of data that you want. So the sample one collects step count, distance walking, running, flights climbed, and heart rate. And when you install it, again, it'll ask the user if they want to share those 4 things, but you could put as many things as you want, and then the user will be able to select which ones they want. You can also set the app up to read data from HealthKit in the background, and you can set the frequency of that, whether it's immediately as soon as the data is generated, or hourly, or daily, or less frequent than that. And you can turn on or off health records transmission. So if someone's connected their Apple Health app to their hospital system, you'll be able to get their medications, their allergies, their condition lists, and a number of other things. So all of those things can be updated in here. And all these files are basically the source code for all the screens in our application. So you can actually go in and edit anything you want. I don't want to take a lot of time showing that. I'm happy to walk you through that later if you have questions. But essentially, if you're an iOS developer, you can go through and edit any of these to your heart's content and build whatever it is you want. All the code is completely open source and for you to do however you like it. So that's Xcode. That's how you set up our application. And I think we're at the point where we can do our demos.
Perfect. All right. So is Mihir going to go next?
Yeah.
And if he is, definitely introduce yourself.
Are you free, ready, Mihir?
Yeah, I'm good to go.
Awesome. Good.
All right. Hi, everyone. My name is Mihir Joshi. I am a sophomore, an undergraduate student studying biomedical engineering at The Ohio State University. And I'm currently working with the Sean and Parker Center for Biodesign, or for allergy and asthma research at Stanford. And I'm using CardinalKit as a sort of basis for an adherence app that we're trying to create for patients undergoing allergy immunotherapies. So essentially, allergy immunotherapies involve a gradual exposure to allergens like peanuts or tree nuts over about a year-long time frame. And my app is going to help patients within the Sean N. Parker Center track their adherence, any symptoms they have, and be able to integrate well with the workflow that they have set up in their clinic. And so I'm going to share my screen right now so I can walk you through some of the key features of my app so far.
And when you get to the features that you recontributed back to CardinalKit, definitely talk about that.
Yeah. Can everyone see my simulator?
Mm-hmm.
Perfect. So here you can already notice that there's a few different tweaks to the sample app that Vishnu showed earlier. So as I mentioned before, adherence is a very big issue in the allergy immunotherapy space. And so here I have a simple task view that patients can complete, and a little survey pops up that allows them to enter the time, because that's an important metric that the physicians want to collect, and also how much of their dose they took. So let's say on this day, the person wasn't feeling so well, so they took about half their dose. So all of this is then saved, and you can see a little mark popped up on our graph here. And as Vishnu showed earlier, you can check previous days. But now let's say, you're in you're meeting with your clinician and you want to show them, a log of what a log of your adherence.
By the way, this was it is currently being done on paper, right? Isn't that the case?
Yes. Yeah. So this is all being done on paper.
Yeah.
And that's why actually they want to use this app, because it's inconvenient for people to write this down. And so streamlining it in a mobile way is sort of the goal here. So, let's say the patient then goes to the clinic to visit their allergist. They can then click this report tab that allows them to select a date range. And so let's say I want to see my logs for 2 weeks. Now here, what's interesting is that they can generate the report, and after a few seconds, it should pop up, and a PDF actually pulls this data and allows the patient to view a sort of a table of their dosing report. And this allows them to then share it to the clinician via email or whatever method they find best. And obviously this is a PDF, so it's easy then to further integrate back into their electronic health record. And so this is sort of like the design I've been working on for the past few months, as it's very conducive to their workflow at the Sean N. Parker Center. But in the future, we hope to make more use of the web portal that Vishnu demoed earlier. And so this is actually one of the features that I will be making a pull request for on the GitHub, as well as custom tasks as I demoed earlier. And so with that ends my demo. Thank you.
That's
Thank
awesome.
you so much, Mihir. That is amazing. And the PDF feature is incredible. A lot of apps will make use of that. So thank you so much for your contribution back to CardinalKit.
So in healthcare, we have the fax machine, right? And then now with Epic, you have, or EHR, you have the PDF. That's the lowest hanging fruit. If you want to get your data into the EHR, you usually share a PDF of some kind of report, and then it goes into what's called the media tab of the chart. So PDF is powerful. Sounds basic, but it's powerful. All right.
Absolutely. And we also have Annabelle Tan here from the epidemiology department, who's working on an amazing app for the Jackson Heart study. I don't know if Annabelle, you could say a few words about the app.
Hi, yeah, thanks Vishnu, great demo, and thanks Mihir. Yes, so my name is Annabelle Tan. I do have we do have a working version, but right now we're trying to update a few things, so it's not currently working. But anyway, the goal of our app is to so we are trying to understand how older adults live in the Jackson Heart Study. And so the Jackson Heart Study is a large cohort study based in Jackson, Mississippi of like something like 4,000 African-American participants. We're tracking their cardiovascular health, their outcomes, but also now we are trying to understand how they live. And so through this app, we're essentially trying to understand, how they spend their time during the day. And so one of the main features of this app is that we will track their location. It sounds creepy, but with their consent, of course. So one of the things in this app that we've come up with is basically, they will just click update location and then stop updating location whenever they want during the day. And then also at the end of every day, the app will push like a local notification asking them to complete a daily survey of how they're feeling, and and present a map of where they've been the entire day to assess whether that's actually where they've been. And so in that sense, we can get an accurate measurement. So yeah, I think it worked quite well in V1. And so now we're in the process of trying to update everything into version 2 of CardinalKit. So Vishnu's been a great help. And I've been really enjoying this process so far, and hope to roll it out in the beta version by like early spring next year, I believe, among the participants in the Jackson Heart Study.
That's awesome. So one of the challenges was leveraging the GPS. Do you want to talk about that, Vishnu and Annabelle, a little bit?
Yeah, I think it's one of the features that we've built into this app is using the GPS to track the location of the patients throughout the day without having too much of a hit to their battery and whatnot. And also providing them, essentially one of the features of the app is there is a heat map, which lets them see, over time, how much time they've spent in a particular location or another location, which is, I think, really cool. Annabelle, I think that's one of the features that I really like about the app.
Yep.
So I don't want to detract too much, but Annabelle, the value of seeing, can you kind of highlight the clinical question you're trying to ask? I mean, is it kind of a social determinants of health, or is it more like how active are they, or are they staying in their home? What's the question you're trying to answer?
Right. Yeah. So I think for the purposes of our study, we're trying to look at it from more, you're right, the more social determinants of health angle, and how, where they spend their time might, like how that's associated with their cardiovascular health. So whether that be like hypertension or CHD, that kind of thing.
I think that's really interesting. And I'm wondering, are you collecting the vectors, like the distance, like traveled or walked? That's another really interesting.
Yeah. So we're currently recording latitude and longitude. That's what we're basically uploading to Firebase.
Yep.
But I think we will have basically difference vectors, so where they've started and where they end up. So that I think is something we'll look at in the analyses. In terms of recording, we have essentially 4 data points, like time and latitude, longitude.
That's incredible.
I was just going to say, one of the interesting solutions we had to solve is to figure out like what type of resolution we need. Like if someone walks from their living room to their bathroom, we can technically detect that, but does that matter for the study? So that was like a really interesting thing to figure out.
Yeah, I think there's no question activity. I mean, there's so much data, by the way, if you need Annabelle references on all those studies, I'm sure you already have them. The correlation between physical activity and health outcomes. There's like very strong correlation. So this is a really interesting study. That's cool. All right. I think we wanted to leave the last 10 minutes for questions and answers. I've been answering a few in the chat. For example, the biggest one that always comes up is it available on Android? Yes or no, Vishnu?
We want it to be available on Android soon. Right now, it's available on iOS. I will say one of the cool things about our platform is that in version 2, because all of our surveys and all of our data are in a completely, not proprietary format, to iOS, it can easily be that same dashboard, those same surveys can easily be also simultaneously used on Android when we hopefully get to building that, which is hopefully soon. Maybe someone in the community can help us out too.
Yeah, that's what I was saying. Any other questions from any of the participants?
I think there was a question, is it safe for the patient to enter their personal information? Yes, we are. I think you answered that already. We are designed for healthcare. All the data is encrypted at rest and in flight.
Yeah,
Sorry, that was answered already.
Yeah, and remember, it's all about trust, and it's all about with the new nationally regulatory, the regulatory approach is that as long as you're very transparent, if you say you're going to do something with the data and then you do something else, and the patient consents to one thing but you do something else, that's where you get in trouble. What's key, this came up in our class we were teaching, is texting okay with patients? You know what? It is okay. But you just have to be very transparent before you start texting, what you're going to be doing and how you're going to be using that interaction and using the data. I think that's becoming the Health Department of Health and Human Services is trying to make it very clear, that we want to empower the patients. We want to give them the right to make choices. So obviously you need to follow safety guidelines and so on, and protect the data as much as possible and not use it in ways it wasn't intended for.
Absolutely. And there was a question, is the tool designed for research purposes and extensible to clinical care models, collaborations between care teams? Absolutely. It can be used for all of those purposes. As we've shown, we can develop apps that are integrated directly into clinical workflows for clinicians to visualize data that patients are generating at home, particularly for patient-reported outcomes or for activity tracking or sleep tracking or whatever it happens to be. So absolutely, yes, you can use it for multiple purposes.
Another question that often comes up is, can I use this for a startup? What do you say to that, Vishnu?
You can. I mean, our product, our framework is MIT licensed, just like React, just like any other open source framework that startups use to build their applications. So you absolutely can.
Yeah, someone has their hand raised, but I can't tell who. Oh no, there it is, Blinn. Hey, Blinn. How's it going?
Hey, what's up, guys? Thanks for putting on this workshop. I had a question: if CardinalKit is available for like mentorship or for helping with code on an individual project, how would we go about like finding some help with that sort of thing?
Great question. I think there are opportunities. I mean, we typically have office hours, where you can kind of check in and get some support. That's probably the best way. But yeah, that's the best way. So we're here to help. I would join the Slack channel, ask some questions, and that's usually probably the best way, to get some support. I don't know, Vishnu, what your thoughts are.
I agree. Just to definitely join the Slack channel. We've got a big community there, and we can find help for you. So
okay,
please do. And we have workshops, and we also have build-a-thons as well. So we'll have a build-a-thon, I think, coming up in the winter.
And also, you can reach directly to either Ricardo or myself, because we have been...
Introduce yourself.
Yeah, please
introduce Alternova. Who is Alternova?
Sure. Hello, everybody.
Just kidding.
Let me actually turn on my camera. My name is Maria. I am a partner of a company that is called Alternova, and we have been developing CardinalKit with Dr. Alami and Vishnu and me here, and a couple of other very, very smart people from the Stanford community. So if there's any technical question you'd like to be answered and you don't want to go through the Slack channel, but you want like a personalized walkthrough, or you want to go over a call to answer any particular question that you may have, you can directly reach out to me, and I'd be happy to schedule a call with you and walk you through it.
Yeah,
they've been my email.
Yeah, Alternova has been instrumental in helping us kind of build things out and also support a lot of groups. We're not, they're there to help. Let's say you have a project, but you don't want to develop it yourself. They're one of our key partners that can help. They know the code base very well and can help build it out.
And if you want to use it yourself, we would be happy to empower you to do so as well.
Yeah. Any other questions?
See if anyone had any other questions. I think we answered most of them. There was a question, can you link to other open APIs such as Strava?
Ooh.
We are working on that. We've been working on a Fitbit integration. There are other things in the pipeline. Right now, our application links to anything that can come in through HealthKit, but we are working on those other connections as well.
And even the back end, I mean, that's something in the, down the road. It doesn't have to be, we'd love to work with, or make it possible to work with other backend service. It doesn't have to be, let's say, Google Cloud in the long run. But, we chose what we thought was best in class and easiest to implement for now. And, obviously want to continue to improve over time.
And someone asked, can you plug in the data to Google Analytics or external visualization tools without storing the data locally? I'm not sure what you mean by storing the data locally. But yes, you can plug the data into Google Analytics or other visualization tools. That can be done. I don't know if the person who asked that is still here, but
Yeah, if you want to clarify that question. But yeah, there's some cool things. We had one project. I mean, you talk about storing things or not storing things locally, but a lot of people in healthcare are very worried. We had a student develop a really cool acne kind of monitoring application where you take a selfie every day and kind of record some other things. And they were worried about that selfie going to the server. So they did something super cool and developed and used Core ML. Is that what it's called? Core ML on the iPhone?
yeah, Core ML.
So it did all the processing, everything on device to do the analysis, which I thought was super cool, to avoid going to the cloud for the images at least.
Yeah, and because we're a fully open iOS project, you can use any iOS SDK that's available. So Core ML is one of those. So you're not limited at all by us. What we're doing is we're writing code that makes all of that stuff work. If you're an iOS developer, you know how long it takes to connect things. And we've basically done that for you, but you are open to add any other functionality that Apple supports on iOS.
Yep, so exciting times. We have a minute left. I don't see any other questions, do you?
No, I don't think so.
Yeah, so yeah, thank you everybody for joining. And we'll have these. I think the least or the lowest cadence is going to be once a quarter, but we may, if there's demand, we may do it more often, one of these workshops. But especially when we have new features to release and so on.
Yeah,
we'll definitely.
I actually have a question. If you still have half a minute.
Yeah,
well,
sure.
Sure.
If
Who
there
are you?
Tell
us, Maria, who are you? Where are you calling from?
Well, I'm a really nerd of biodesign program of the Stanford. I'm reading all about this since 4 years ago, and
Nice.
I love the program and everything. And I just made friend Maria a couple of days ago.
Okay, fantastic.
And yeah, my question would be, and I know about CardinalKit, I was using it from last year. And I have a question. Have you thought, I'm not sure, I don't know like everything about CardinalKit, but one question would be, how can, like, if you have medical data, for example, photos, radiography, anything that's image or something that's right, can you download it on your computer, or it's safe in the cloud? Like, if you can download, it's not safe from the patient's perspective. If it's secured in a cloud, would be better. I'm not sure how it's working.
You're saying, so I think you're talking about, so you're not talking about DICOM specifically, but you're saying, what if I have a JPEG of an X-ray or a JPEG of a wound?
Yes.
Where is the safest place to store it? Is that the question?
Yeah, well, if it's stored already in the CardinalKit platform, can I take it to my computer and have it personally if I'm not the one that has the picture? Like, you have the picture, but I'm in the same team as you are. So maybe I can have access to that picture.
So, if if the patient, it depends, you know, what the context is. If it's research, if you're a clinical care team, you know, the way it works in a hospital, you know, the electronic health record has everybody's data, right? And all the doctors in the hospital can look at that data. You're not supposed to if you're not taking care of that patient. So the way I would think of it is, you know, in whatever context, if you're storing it in the dashboard, let's say, and, you know, it's someone else's photo.
Yes.
If in the context of the engagement, you're like part of the care team or part of the research team, and you know, the patient's given consent, like, oh, this photo I'm giving to you as a research project for the research team to work with, then it's okay. Does that make sense? But if you're
well, it makes in somehow it makes, but if I don't know, I see some cool pictures for some patients with, let's say, psoriasis, and I want to have them because I'm going to do a research, so I'm stealing them, even if I'm in the team. Can I do that? Like, it's not ethical and so on, but can I do that from the platform perspective?
Yeah, I mean, that's a complicated question. I see what you're saying. It's almost like a medical educational file that every doctor, me included, is guilty.
Yes.
If you, and the funny thing is, like, my kids go through my phone, they have to like cover their eyes because it's so disgusting.
I know, yes.
So I know what you're talking about. So you're saying, for purposes like that, can you use the platform for something like that? Is that what you're saying?
Yes. Yeah.
I think if you want to upload images, it is definitely a more secure place to upload images than, let's say, my iPhone photo gallery or something. So
that everyone has access to. Yeah.
Yeah.
I mean, your family at least.
Yeah, exactly. So it is, I would say it's it's better. Now, you know, is it okay to be doing, you know, as long as you know, with the photos, it gets complicated, you know, and I don't want to provide legal like advice here. It gets complicated, but yeah, no, I see. So you're saying, can I use it? Can I use CardinalKit to set up something to capture pictures, annotate them, whatever, so that I can have a teaching file or a teaching or whatever. I can have a set of images that are of interest to me. Something like that.
I mean, for example, if you go into the app of a bank, if you go into your bank account and you try to do a screenshot, they don't let you do a screenshot for on your phone. So it's a security measure that they do, but you can take a picture with another phone, for example, but you cannot do a screenshot of your phone if you're on your account.
Well, one thing I will add there is that if you want to have more sophisticated security protocols, you can do that. I mean, Google Cloud does allow you to do that. That would be something you would have to do, you know, as part of your project when you set it up. You can set up rules that information in certain collections can only be accessed by certain people. You can look into Firebase rules and then they'll let you do that. So that is definitely doable. We don't provide that out of the box, but it is something you can build.
So I can build in the CardinalKit something like that.
You can use CardinalKit to build a solution like that. You would have the tools are there. You have to actually go through and create your own rules for who is supposed to be looking at what and who belongs to what group. Like, for example, you could put certain doctors that are taking care of these patients in one group and certain doctors in another, and you can restrict who has access to what. Those are all features that Google Cloud provides. So you can totally do that.
Okay, perfect. Thank you so much.
No problem.
Sorry
no problem.
I have to run, but Vishnu, if you need to answer questions, I may dial in. I'm going to dial in, but I got to run.
I'm happy to answer if there are any other questions.
Everyone. Yeah.
I'm also going to throw my email address in the chat if anyone wants to email me a question.
Can I have a quick question, I guess, building upon Maria's? So I'm from Sydney, Australia, actually, UNSW.
Awesome.
Sydney,
wow. What time is it over there?
It's 12 p.m. Lunchtime.
Wow.
And I first know CardinalKit actually from Ashley Griffith.
Oh, wow. Ashley Griffin. That's awesome. Yeah, Ashley and I work really closely together.
So yeah, so it's amazing that what you're doing, I would say. So I'm doing my PhD here on breathlessness, and I'm just thinking whether this can be something that is, I would say, expanded in that space actually. And I had a question earlier on how we export data. I think I saw earlier from the dashboard, it's exporting each and every question separately, or is there any other feature to export data, including the, for example, activity data as well in a nice way?
Yeah.
Analysis?
Yeah, there is actually. So if this is a built-in feature of Firebase, but actually you can export data from Firebase to BigQuery, which is a Google managed SQL table. And so you can actually take the data in Firebase and basically write some rules for like how you want to map from certain fields in Firebase to certain, columns in your SQL table, and it will automatically do it for you on a periodic basis. So your data will be always available, in a SQL table, which is a lot more easier, to use for data analysis. And from our dashboard though, you can essentially at this point, you can download everything as a CSV file. So for each survey, you can download all the responses as a CSV file. We haven't set up any way to download the actual data from the, health measurements from the devices. That tends to be a lot of data. But you can download it. You can download it directly from Firebase. And sorry, go ahead. Oh, sorry. Yeah, I was just saying you can download it directly from Firebase. It's in OpenMHealth format, which is, like we said, this international standard for mobile health data, which includes a lot of metadata, like the type of device it came from, and some associated information. So that could be useful for analysis. But yeah, basically there are different ways to do it. But super awesome that you're considering using it. I think it would be great to see that use case.
Yeah, thanks.
Can you tell us about your project a little bit? What would you use it for?
Yeah.
Sure, thanks. So my project is on breathlessness, as I mentioned, chronic breathlessness. And what I'm thinking of using it for is to track patients' breathlessness level. So I think the survey feature probably is one thing, and then give them some sort of non-pharmacological intervention. So we're developing patient materials and videos and the sort, and then seeing whether